Well, Dr. Betta Edu, Cross River State Commissioner for Health, joins us right now on the program for more on the vaccination rollout. We'd like to thank you for joining us. If we remember correctly how the attitude or sentiments of Cross River at the beginning of the coronavirus pandemic, now the vaccines are coming in. What are those sentiments towards the vaccine?
Okay, thank you. We're happy that the vaccines are finally in the country, and we're happy that health workers can gain access to the vaccines. Of course, we have done our own homework in Cross River State, and we're ready to receive the vaccines as soon as they begin distributions to the state. Presently, trainings are ongoing at the state level and at the local government level for health workers. E-registration would be starting almost immediately, and we are believing that we can get all health workers registered online so they can be eligible for the vaccines. We hope to receive the vaccines next week in Cross River State, and we would be giving the vaccines to frontline health workers, including those in the military and paramilitary. We also would be giving some strategic leaders within the communities. We've been doing a lot of work around risk communication, letting our religious leaders, health workers, and others understand what the vaccines are about and how it can protect them. We've been fighting against so much misinformation, especially going on the online media and social media. A lot has to be done just to overcome this.
So even the Nigeria Governors Forum are insisting on the safety and efficacy of the vaccines. I mean, as a public health physician, are you in doubt as to the vaccines?
So I'm not in doubt as to the efficacy of the vaccines, even though the efficacy is not 100%, but I'm not in doubt as to the ability of the vaccines to reduce the mortality and morbidity associated with COVID-19. There's nothing that comes without a risk. So within the population, there could be 1 or 2 persons who would come down with adverse effects following immunization. However, that should not deter the public from taking up these vaccines. And you've heard from several quarters, it's important, even after taking the vaccines, to continue to use your face masks. Remember, the first dose doesn't give you as much immunity as you might need. And even after the 12 weeks, when the second dose would be administered, it doesn't still prevent you from transmitting. It can only prevent the virus from affecting you. So you need to be able to protect yourself and at least wear that mask to protect others in public places.
Finally, Dr. Edu, what is the quantity that your state is expecting, and is it sufficient for the 2 doses for each person?
So they're not giving vaccines for the 2 doses right now. It's just the vaccination for 1 dose. And like I said, they're prioritizing health workers and the strategic leaders within the state who will show that example to others that the vaccines are safe for taking. Right now, the final numbers that will be coming to Cross River has not been determined yet. And this is because we have just collected today the list from the military and the paramilitary, and we'll be sending that to Abuja, to the National Primary Healthcare Development Agency. That will form the total number that is supposed to come to our state. And of course, they have to factor in some more vaccines for strategic leaders. So we should be looking at a little, probably above 20,000 vaccines coming to Cross River State. Our coaching systems are ready, and we're working with them to see that the logistics are perfected.
We'll continue to follow the developments. We appreciate your time on the program. Dr. Betta Edu, the Commissioner for Health, Cross River State. Thank you for joining us on the program.
Thank you very much for having me.